Hey everyone, so we wanted to make this video where we'll be covering our go-to loading strategy for lateral elbow tendon pain, okay? Because we've been seeing a lot of clients in clinic recently with lateral elbow pain, but it's not the kind of lateral elbow pain where things get stiff and sore every now and then after activity, for example, but it's the kind where it's very irritable, very sensitive, and it's clear that the client has some kind of tendon overload. So we're dealing with more of a tendinopathy here, and we're dealing with more of a tendon overload. We need to look locally early on, much more locally early on, while simultaneously addressing, global limitations. But we need to narrow our focus early on the common extensor tendon and the wrist extensors, and be much more, structured and purposeful with our loading strategies. Okay, that aims to restore the low capacity to the wrist extensors in this case, because the general thought process here is that these issues can persist because there's a protective reduction in the muscle activity or the motor output being distributed through those tissues, the wrist extensors in this case, and that can lead to a continued overload of the tendon. Okay, so isometrics are seen to be a very effective strategy to restore that neural drive or restore that motor output to these tissues. But when we're dealing with a grumpy tendon, we need to be strategic with how we're positioning the forearm and how we're positioning the wrist in this case as well. Okay, so we're going to cover these two separate strategies here. Both strategies have pros and cons, but we'll typically use this strategy early on with clients dealing with these kinds of issues, because when you're dealing with it, like I said, with a grumpy tendon, you don't want to put an awful lot of internal compression through that tendon. You're essentially lengthening that tendon under load. Okay, so when it comes to the common extensor tendon, that's going to be more internally compressed when we pronate the forearm and flex the wrist. Okay, so early on, some therapists might use a strategy like this, where we are kind of positioning the forearm on a table. We have some external load through the hand and the wrist. We're extending the wrist. So we're shortening the wrist extensors. You can say in the sagittal plane, but we're getting a lot more length through that common extensor tendon in the transverse plane through the pronation of the forearm here. Okay, and oftentimes when we get clients that are very irritable, very sensitive in this position, it might feel okay for the first 5-10 seconds, but they'll report that the pain increases over the course of a 30 to 45 second hold, and then we don't mind 3 out of 10 level of pain as long as it doesn't linger or increase across the activity. But one of the reasons we feel this is occurring is because it's just too coordinatively challenging for the client early on. Okay, so we would rather try to reduce that internal compression as much as we can early on and get a sustained distribution of load into the wrist extensors in a way that's much less coordinatively challenging. Okay, because one of the things that you'll understand if you can appreciate the mechanics and the mechanical couplings of the wrist and the forearm is that when we supinate the forearm, that will typically couple with an extension of the wrist. When we pronate the forearm, that will typically couple with a flexion of the wrist. So what we're doing here now is we're expressing these opposing couplings, where we're pronating the forearm and extending the wrist, which can be much more coordinatively challenging for the client, as well as the fact that we have to couple finger flexion in this strategy here, where we're holding onto a dumbbell. Okay, so sometimes that can just be too coordinatively challenging for the client. Their wrist extension will couple with finger flexion as well. So we do eventually want to progress to this strategy, but we'll just cover the strategy that we like to use early on much more so, because again, it positions that tendon, that common extensor tendon, in a much less internally compressed position, because we have a supination bias and a wrist extension bias. We're holding a tennis ball just for comfort. We're not squeezing here. But what we're asking the client to do then is we're extending the wrist, and we're asking the client to actively drive the knuckles down into the block here, and not just drive the knuckles to the point where we're just trying to keep an isometric distally and then drive more an extension torque at the elbow, but we really want to encourage that extension torque at the wrist as well, because we really want the client to sense that force being distributed through the wrist extensors here. Okay, And typically, again, this will be not necessarily coordinatively challenging, but the client will be able to sense that force moving through those tissues much more so, because that's ultimately what we want to try and achieve here. We're trying to increase the neural drive, the motor output through those tissues, but we're trying to do it in a way that doesn't irritate that tendon. Okay, excuse me. Because this is very important early on, because what we find generally is that we get a lot better analgesic effect with this exercise here too. We're trying to hold that for, I'll pull it up again there. We're trying to hold this exercise for at least 45 seconds at 30 to 40% of the client's maximal voluntary isometric contraction. And if this does provide an analgesic effect, or if this does allow the client to really sense that force moving through those wrist extensors, this will be something that we ask the client to do for 5 sets of 45 seconds across the day. Okay. And one of the reasons, again, like I said, we can find it more helpful is because, again, biases that forearm supination and wrist extension isometric strategy early on. It's a little bit more of a concentric bias here. Okay. And the concentric bias here is important because when we have an isometric activity with more of a concentric bias, it allows the client to have a little bit more control over how much force they're actually expressing. So again, it's much easier for me to take tension off and put tension on when I'm driving more of a concentric strategy in a closed chain position as well, or using a closed chain strategy here versus an open chain strategy here. So kind of building or ramping up that tension is much more easy to manipulate with this strategy here versus here. The only way we can manipulate the load is by increasing the external load. Okay, there is going to be an elbow extension coupling that we can incorporate here as well, because we do eventually want to challenge the isometric behavior of the wrist extensors as we challenge and get dynamic movement through neighboring segments as we progress. Okay, so we can get dynamic motion through the wrist here. We can change the wrist position from extension to a little bit more of a neutral position or a mid-range position where we're trying to get a little bit more length into those tissues, but we're gradually increasing the length into those tissues over time and then adding a little bit more dynamic motion to it. Like I said, it also allows us to manipulate the amounts of muscle activity we are expressing here. So like I said, we're starting with a 30 to 40% of their maximal voluntary isometric capacity, and then we can gradually increase that over time. But like I said, we can only manipulate the external load with this strategy here. And we often find that this is much less coordinatively challenging for the client, because again, we're working with the forearm and the wrist in a way that allows the segments to move in their preferred coupling strategies. So forearm supination, wrist extension, versus trying to get a dissociation in those coupling strategies where we're pronating the forearm and extending the wrist, which can be much more coordinatively challenging for the client, because we don't really want to challenge the coordination across kinematic segments or joint segments early on here. The goal is to increase neural drive, to start to restore motor output potential through the associated tissues here, and then gradually begin to change the kinematic behavior, change joint segmental relationships with the strategy here. Okay, so again, just a quick video, but something that we find very, very helpful at the beginning of our loading strategies with lateral elbow tendon pain. Because again, if this does provide that analgesic effect, or if it does give the client the capacity to sense that load and manipulate that load moving through the wrist extensors much more easily, then it's going to be a consistent feature of the rehabilitation process as we progress. So as we challenge things more and more, we will typically keep this as a common strategy that's used to provide that analgesic effect across the rehab process, even as we're challenging the forces, we're challenging the speed, we're challenging the dynamic motion of segments throughout the rehab process. We always want to have that one strategy that gives the client that analgesic effect, and these isometric strategies performed in a position where we're not creating as much internal compression through that common extensor tendon can be really helpful.